welcome to the Smart Podcast. My name is Esther Kiringa. I'm the Group Marketing Director. And this morning, we are very happy to host Harrison Muiru, who is the Managing Director at Smart. Harrison, good morning.
Good morning and hi, Esther.
Very fine. How is your Tuesday this morning?
Fantastic.
So straight on to the first question. Harrison, tell us, you've been in the healthcare space for quite a number of years. Tell us about Smart and who is Smart?
Smart Applications is an ICT technology services company. We're a group of young, energetic individuals who are changing the landscape of healthcare technology across Africa. We were born out of an innovation cycle around 20 years ago on how we could solve challenges in the healthcare space. So today we are proud to be in 11 countries, very fondly known because of our smart biometric medical access technology that is spanning across 6,000 different hospitals in 11 countries.
Wow, a whole 11 countries in barely 20 years. Tell us, Harrison, why healthcare?
Well, when you look at the essential services that are provided, as a human being, healthcare is a fundamental right. And we felt that it's one area that we could impact humanity in a very big way through technology.
Okay. In terms of how have you been able to capitalize on the healthcare opportunities, especially in Africa, where we have the youngest population in Africa in terms of they're barely 17, the average age. How have you been able to identify and capitalize on opportunities in the healthcare space to drive growth and success for your organization?
What happened is that we started by studying the market, looking at what were the challenges to access for healthcare. As you all know, within the UN Millennium Development Goals, there is the aspect of healthcare and well-being that is entrenched in SDG number 3. When we looked at the aspects of managed care, there was very low penetration. And even as at today, the numbers are not looking good across Africa, with the exception of countries like South Africa, which are more advanced economies. So there's the challenges around how do people have managed programs for healthcare that are affordable and that are sustainable. And we've had the advent of medical insurance playing a very key role around that particular space. So we were able to look at how do we harness and provide more value across that element of medical insurance so that you could have more people coming into sustainable medical insurance programs. And that is what has inspired our technology.
Wow, thank you so much. In terms of stakeholders, we are always told that you must be able to work with other stakeholders to be able to scale. Have you been able to work with stakeholders before? And in Smart, do you work with stakeholders?
Yes, we've been able to look at definitely the spirit of partnership when we look at our stakeholders. The healthcare value chain comprises of different stakeholders, starting with the patient who's accessing care. There's also the caregiver, who might be a healthcare facility, a doctor, a nurse, a pharmacy, a laboratory specialist, and many other healthcare actors. There are also other stakeholders like the insurance companies and intermediaries who are medical brokers who provide certain services that actually mediate between corporates who are looking for insurance programs for their employees and the actual insurance players who underwrite the risk. There are also different associations across that landscape, like the Association of Insurance, like in Kenya we have ACI, we have the regulators like IRA, and we have the government, which plays a very central role in defining healthcare policy. So what we have done across the years is to be able to engage with the different stakeholders around the use of technology to ensure that there is healthcare access efficiency. Looking at the member being able to access healthcare in a more convenient manner without the hassles of having to engage in a laborious and tedious process of calling insurance and emails and lists and letters flying around. And that has also translated to an impact in the quality of care, because then the healthcare practitioner is able to focus on their core role, which is actually to provide treatment to their members.
Okay. In terms of an ICT company, are there any policy or regulations you've had to comply to as you scale the business?
That's a very important question, especially it's coming at the advent of the Data Protection Act. And data protection has been the most profound policy in the recent past that has impacted us. As a registered data controller and data processor, Smart Applications has had to look at safeguards that heighten the securities that we have always had around the protection of healthcare data. Apart from policies to do with data protection. We've also looked at the globe in terms of world standards. And as of today, Smart is one of the few healthcare technology companies that are ISO 27001 certified, which is a world-class security standard. The other things that we've done is look at other different policies that are coming into the space, things that are touching on any of our stakeholders. As we know, for example, in Kenya currently there's a discussion around the e-health bill, which will touch on telemedicine and will touch on digital health delivery. And those are now elements that we are now closely ensuring that we align our technologies continuously as per the ongoing conversation. We recently participated in a very good conversation with the Ministry of Health around the Envision Digital Health Superhighway, and how actors like ourselves as digital solution providers can ensure that we conform to policy and regulation around e-health delivery through the solutions that we provide, be there electronic medical record systems, claims processing systems, client and healthcare provider registries. Those are things that are currently being discussed, and policy definitely plays a very key role. If you look at the insurance sector, insurance is also very well highly regulated. Case in point, we have the current ongoing discussion, or rather enforcement of risk-based capitalization, which has affected many insurance companies. And what this has fostered is a unique environment that is catalyzing innovation, because insurance companies now have to make sure that they are more efficient in their processes in order to improve their insurance performance ratios. And that means that we have been able to launch certain capabilities like our electronic claims processing solution known as Smart Electronic Data Interchange, EDI, which has saved insurance companies and added a lot of efficiencies between the claiming process that was otherwise done manually, between the healthcare facilities at the point of invoicing, and how that data flows back to the insurance companies for purposes of settlement, validation, and all those processes that are done from a claims processing perspective.
Thank you, Harrison. Allow me to ask, in the 20 years being an ICT company,
yes,
have you had any challenges? And if yes, what are these challenges? You know, IT is very dynamic. Year on year, IT keeps on changing. And being an ICT company, what would you say have been the key challenges that you faced over the years?
Absolutely. There have been many challenges, and that's why my hair is thinning out. Very soon I'll be bald. It's been exciting journey because challenges actually foster new thinking, new innovation. Some of the challenges that we had earlier on when we came about 2003, 2005 was an era where there was the IT buzz, but computerization was a very expensive affair. And that impacted us because the solution that we are rolling out for automating medical access was purely hinged on computerization at the healthcare facilities. So that challenge made us think out of the box, and we decided that would actually help healthcare facilities in their computerization journey. And part of what we did in the earlier years is to say that not only are we providing software for this healthcare facility to use, but would also provide ways and means that they could access computer hardware vendors. And we would actually go and start training the hospital personnel on how to use computers. Now, if you recall back in the early 2000s and the early years of this millennium, a lot of processes at the healthcare facilities were manual. You'd get a medical patient a book or a paper that would be used to store your medical records. Nowadays, we've been part of the journey through our Smart Health Hospital Management Information System, where that process is entirely digital and patient records are stored in a computerized manner. So that challenge of computerization actually led to an innovation around our Smart Health Management Information System that currently is digitizing the patient processes in any healthcare facilities. Another challenge that we faced was market acceptance. As you know, being the forerunner, the inventor and innovator of the first use case across Africa on biometric use in a healthcare environment, there were a lot of questions. Some of the questions that came in from certain quarters of our population was, by using biometrics, was it now an aspect that would touch on matters to do with religious doctrine in some cases? Was it something that was biblical even? So there were so many questions that came in. And what we did is that actually it made us look at the customer conversation in a different way, where we now have, as part of our customer process, an education and awareness session where we take our customers through the process that the biometrics is actually a process that is non-invasive to you as an individual and does not store your personal data. And in that way, we've been able to get biometrics to a level where it was accepted, even to the point where we've seen it being used by for national elections. And nowadays is a commonplace across our homes, where we have biometric locks, our offices where we're using biometrics, and even our phones where we're now unlocking them through biometrics. So inherently, challenges have made us better in terms of innovating and inventing.
That is so true, Harrison. And I remember just this week, there was this craze of WorldCoin going on. So in terms of, yes, biometrics has really changed how healthcare is accessed, is really, really key. In terms of smart, what can you say has been a specific turning point for the business over the 20 years of operation?
Mm-hmm. There have been several turning points because in ICT space, you always have to keep on reorienting and reinventing yourself. Back in the day, our most significant turning point was when one of the first insurance companies to believe in our solution actually adopted the solution on a full scale for their medical scheme underwriting business. And then we were able to scale, because when we started off, we only had a paltry 30 or so medical service providers who accepted and believed in us. But the first turning point is when insurance company looked through the challenges and the solutions that we were giving them and said, yes, this is a solution that will solve our challenges. And we were able to jointly formulate a project that started actually turning that dream into a reality. We are glad to say that that insurance company, being one of our first and foremost believers, is now fully automated across their end-to-end processes in their medical scheme insurance value chain, and have been able to grow the business over 4 to 5 times the way it was back in the day. So we are seeing that there are always new pivots that one has to. The other pivot I can talk about happened in the advent of COVID. Because COVID had a huge impact on our supply chain mechanisms across the world, globally. And actually what it did is it actually also triggered a deficit of smart card chips. And as such, we had to pivot and look at what is the new way that customers are accessing services digitally. As at today, we are very proud because our smart virtual access solution, which is fully mobile-based, has received full adoption across the board and is now a very convenient way that members, through non-card technology, through access at their fingertips, which is through on their mobile phone, are now able to access conveniently. So COVID also made us pivot towards the smart virtual access solution. We expect more pivots to come in future because we are constantly looking at the landscape. What is happening next? We're now seeing the advent of AI. Will AI make us pivot? Definitely. So I'm telling all listeners to watch this space. There's more coming.
Watch this space, team. In terms of lessons, what would be your key lessons and advice you would give to aspiring entrepreneurs in the ICT sector?
First and foremost, I would actually advise them to be bold about their ideas and their innovations and concepts, but also to be resilient. Change does not come easy, and technology always comes with a change. It always comes with a change in a process, in a way or mechanism that is been traditional and now has to be revolutionized to be digital. It always comes with some bit of resistance. So I'll always urge ICT innovators, just like Smart has done in the journey that we've traveled across the last 20 years, to be bold and ambitious, but also to be resilient in the face of adversity and the change management that is required. That does not mean that you walk a journey alone. You must walk with your customers and your stakeholders. And that constant conversation is what fosters success. That is what has been part of our mantra, Smart, walking the journey with our customers, listening to their asks and requirements, but being bold and ambitious to ensure that we've delivered to those asks and beyond. Thank you.
Wow, thank you so much, Harrison. To our listeners, that has been an impactful conversation. with Harrison Muiru. We will be back online on this podcast in the next week, and we'll definitely let you know the time. Thank you.